Hello, everybody. This is Dr. Kevin Connors, and this is an introduction to my book, which is going to be a different kind of book because it's going to be a video book, and you're going to get videos just like this. The book is Cancer Genes, How Genetics Can Be Both a Cause and a Cure. And we use that word very lightly because currently I don't believe anybody is cured from cancer unless God intervenes completely. I believe we all have cancer, and that even when we go into full remission, and even when an oncologist says you are completely cancer-free, you are never completely cancer-free. That's why when it does come back with a vengeance on different people, that it never did come back with a vengeance because it was never gone. So dealing with cancer is a serious disease, and dealing with cancer needs you to become serious and not just take one person's word for anything. You want to dig into things, and this is why I dig into things like your genetics. We're not just looking at tumor suppressor genes, which many people have come to me and said, oh, I've had my genes all run. Look at them and they've had 30 genes run. Well, we want to look at about 900,000 SNPs and look at different SNPs that are not typically looked at by other doctors. Things that affect your detox pathways. Yes, your tumor suppressor genes, different tumor pathways and metabolic pathways that can stimulate both growth and can hinder the suppression of cancer. Knowing these kind of things and knowing what we're going to talk about in this book prior to you ever having a diagnosis of cancer would be extremely beneficial. So that if you knew you had defects in specific detox pathway, let's say, you could address that and support that pathway and maybe even be more careful on how you may be hindering that pathway by your diet and exposure to different chemicals and such, so that you can help prevent cancer in the long run and any other serious disease as well. So very beneficial, I think this will be. So series of videos is what this book is going to be. So it's going to be a little bit different. We're going to go over important genes related to cancer and recovery from cancer. We're going to go over genes that give clues to the best diet that a person with cancer might want to ensue. We're going to go over genes that suggest pieces of cause, like that detox pathway defects and such. We're going to go over genes maybe less related to cancer, but give a bigger overall picture of a person's health. So even if you don't have cancer, this series may be very helpful for you. And we're going to go over things that you may want to relate to your offspring, because if you have defects in certain pathways, you may pass those on to your children. So it can be very beneficial for them to know what's going on as well to help prevent some of the problems that you've had. Make sure we understand the understandings. We are not making any health claims in this book. You need to consult your doctor. This is not a substitute for your general or oncological health care. The legalities of this are, this is my information, and I'm passing on my information to you, things that I'm searching for my patients and my own health and my own family. And it's my opinion. And you don't take this irresponsibly, but you take this back to your current doctor, if I'm not him, and communicate that with your current doctor, and maybe make some changes in your life. So this is meant to be also an ongoing living video book. I'll be adding videos constantly to this, and it will be continuing to grow as new information comes up, and even new information may contradict old information, so stay up with the videos. All right, thank you very much.